Hello, everybody. This is Dr. Eric Westman with Adapt Your Life and the live on Friday. Hope everyone's doing well. I'd like to talking to you from the Lifestyle Medicine Clinic at Duke. I'd like to talk today about macronutrients and ketogenic diets. I've seen a lot of people come into the low carb world and they come to the low carb world by way of keto clarity or ketogenic diets. The interesting thing is, in my clinic, the way I was taught by the doctors who used the ketogenic diet for weight loss and for diabetes treatment, is that we don't really ask people to calculate macronutrients. So when I see people coming in through keto clarity, through ketogenic nutrition teaching, many people are worried and thinking they have to calculate their macronutrients very carefully, and that if there's a certain range you have to be in, they're worried about being in that range. So I want to provide some confusion or some clarity to this confusion, and it seems to me that it depends what you're trying to accomplish. So if you're really looking at a low carb diet, a ketogenic diet to lose weight or to treat diabetes or epilepsy or some other medical condition, the weight loss and the diabetes treatment can be done without calculating the macronutrients. And so I help people understand that the body pretty much figures out what to do with the food and nutrition that you have. So if you're in my clinic, and the way doctors use this diet for years is just giving a list of foods that are very low in carbohydrates, very low glycemic food. The appetite goes down after a day or two, the hunger goes away, and the body starts fixing the diabetes, blood sugar comes down, or the weight starts coming down without any explicit calculation of the macronutrients. It's a simple method. It works across a wide range of socioeconomic status levels, and whether you want to spend a lot or a little on the money, whether you want to spend a lot of money on the food, whether you want to spend a lot of time or a little time. So you don't have to calculate macronutrient ratios if you're being trained in a adequate protein, high-fat diet using a list of foods that have been used in clinics for years. I mean, this would include other types of programs in the diet books that are available. So I don't ask my patients to calculate their macronutrient levels. In the studies that were done, it ends up that people are eating roughly 50 to 60, 65, 70% fat in the diet, but there's a wide range. And so what I see in my clinic is that people figure out different ways to keep the carbs low and to get great nutrition without worrying too much about the macronutrient fat, about how much they're having. And I don't really ask my patients to worry about the protein percentages as well. We do know that we think the consensus is that the human body does best with some protein every day, but the harsh reality is we don't really know how much that protein is. I mean, we teach a certain level, 1 gram per kilogram lean body mass or 1.5 grams per kilogram lean body mass for if someone's taking a test, for example, to become an obesity medicine specialist. That's what you give back as the answer, but the science is not so clear on how much protein you need. I think I'll do another live chat on how much protein you need in an upcoming session. But just in terms of how much and whether I ask people to calculate it, I really don't. And so one of the advantages of a simple low carb or ketogenic or LCHF system is that you don't have to do a lot of calculating. list of foods is excellent nutrition, and then the hunger goes down so that you just eat till you're comfortably full. It's actually pretty simple. Now, that's for diabetes and weight loss. One last comment about the weight loss is that if you're trying to find a certain amount of fat in the food, you can actually overconsume fat to the detriment of the weight loss. So, because the calories that you eat do matter, it's just we don't count them. And so I've seen some people overconsume the oils and the butter and coffee, for example, and then they wonder why they're not losing weight. For example, someone will be having success, and then it stops, and I just ask what changed, and they started having more oils and more butter, consuming more calories in the drink. So that's one thing you want to be careful about. So don't feel like you have to increase the amount of fat you eat or drink, because I want you to use your body fat as the main source of or one of the main sources of your energy when you're trying to reduce your body fat. So, so I hope that clarifies the reasons why we don't calculate, and I don't ask my patients to calculate the macronutrients when they're trying to lose weight or fix diabetes. Now, if you're trying to achieve a certain ketone level, let's say you're not trying to lose weight, you're not trying to fix diabetes, you're trying to achieve ketone level, ketosis for therapy. Some people are doing it now to on the hope that it increases your metabolic performance, exercise performance. If you're trying to also use a ketogenic diet on the hopes, the promise that it might help with cancer or Alzheimer's or some other disease. The interesting thing in animal studies, the amount of ketosis can actually change the disease in some cases, but we're really actively looking at this science, and it's not quite to the level of human research where I would sign off on it or guarantee that it's going to work, but if someone comes to me to try to achieve ketosis at different ketone levels to treat these things, I'll help them do it. So you would want to calculate your macronutrients to achieve a certain level of ketosis. And so I've seen people, and many of you may have already changed the percent fat, the amount of protein in your diet, and you see different ketone levels. That is something that you can do on your own. You can use breath, blood, or urine ketones, although most of the experts are thinking that the blood beta-hydroxybutyrate is probably the best gauge when you're trying to change the level of ketosis on your own. You can get one of these meters that checks the glucose and the ketone levels. But I really don't know what to advise in terms of what ketone level to be at, and everyone comes in thinking that higher is better. We don't know that for sure. And what's the optimal level? The research just hasn't been there to guide us. So a lot of people will go on how they feel, where they feel better, better mental clarity, better hunger suppression, and find a certain level on their own. But so you might want to calculate the macronutrients if you're in aim for about a 70% of the dietary calories from fat, if you're trying to get into ketosis and maintain it. But again, for folks who are in my clinic for weight loss or diabetes treatment, we don't ask them to calculate the macronutrients at all. I see a couple comments, hello, and a couple questions as well. Early on in a strict ketogenic diet, the way I teach the diet is I don't allow nuts or seeds at first, but that's because these represent trigger foods for many people. A trigger food is something that you can't stop eating, and so if you let yourself have access to a whole jar or tin or bottle of nuts and you can't stop eating them, basically I've sabotaged the program for you by allowing you to have them because you can't stop eating it. So many people can't do that. That's why they're not allowed at first. Although if you are able to, say, have some seeds or nuts on a salad, or you're containing them so that you don't have access to the whole jar and overconsume them, then you probably can have them. So it's really kind of a judgment call. In my initial teaching of, because probably 60% of people will overconsume the nuts, I'll say stay away. If you're in that 40% who can actually have them and not overconsume them, then fine. That's really true with any kind of food. There's no forbidden food on a ketogenic diet. It's just that if there are carbs in the food, you can't have much. So, most people will say, what's the point of having 1/8 of a cup of berries, for example? There was a question about how to get started, the basics. There are a lot of simple systems. We put together a video at adaptyourlife.com that you can watch going over the basics. Other simple systems are the books that are available include The New Atkins for a New You. I was an author on that, but it's a little higher in carbs because it is using the net carb kind of system and counting. On a ketogenic diet, I'd rather have you use the total carbs because some people do absorb those fiber grams, and the sugar alcohols can affect the ketosis. So there are a lot of simple systems, ways to get started. The Heal Clinics at healclinics.com was created in order to give more teaching and more availability to clinics that know about ketogenic diets. So you might check out adaptyourlife.com and healclinics.com. The Adapt Your Life products were designed to allow people to have convenience items with truly low total carbs and without harmful ingredients or ingredients that have preservatives in them. So you might check out the Adapt products as well. I see there was a pretty sophisticated question about what I thought about the NUSI study that Kevin Hall was the principal investigator on. Of course, I highly recommend the blog that Mike Eads wrote at proteinpower.com about the NUSI article. I pretty much agree with what he said. My read of the article is that it was actually a positive study. There was a difference in the different diets, and then they just concluded that because it wasn't as big as everyone said it would be, that it didn't have any difference when it actually did. So that was kind of disappointing to see that. I think the study will be informative and helpful because the method section is so good, and if you're a researcher writing grants, you really don't worry about the conclusions the authors had. You look directly at the methods. So I would encourage scientists to actually use the Hall paper as use the methodology and the results and ignore the conclusion that was made. So I think over time the Hall paper will have influence in a good way. Let's see, what's the difference between low carb and ketogenic lifestyle? It's a matter of degree, right? It's the number of grams, the amount of carbs, and it depends on the person. So that some people, if you're young and you're active, you're able to eat 50, 75 grams of carbohydrate a day and have ketosis and be fat burning. The older you are in general, the less carbohydrate you can have and still be in ketosis or the maximal fat burning level. I say ketosis is just maximal fat burning. That's really all it is. And nutritional ketosis is very different than the ketoacidosis that most healthcare professionals have been only trained in. So the lower you go on the carbohydrates per day, the more likely the individual will be in ketosis. So when someone comes to me wanting to get it right the first time, I will teach them the 20 grams or less because by trial and error, it was found that just about everyone will have ketosis or be in the maximal fat burning phase if they're under 20 grams, total grams per day. And the net gram is basically doubling the total. So 20 net is like 40 total, and some people can lose weight at that level. I kind of look at it like the over-the-counter version of a drug. It works for a lot of people. There are some people, though, who need the prescription strength, which is really just going from the 20 net to the 20 total grams. The question about the Heal Care lifestyle plan, the Heal Care plan is modeled after a ketogenic program, the ones that Dr. Atkins, Dr. Eads, Dr. Rosedale, Dr. Bernstein, all of the doctors who use the diet clinically, and it starts people out at a 20-gram level. At healclinics.com, what you do is you fill in a questionnaire. If you don't have any medical problems, you get set up with a partner who helps you, teaches you, and supports you along the way. If you have a medical problem, then you'll be directed to one of the Heal clinics, because you have to have monitoring to help get you off medication safely, or if you have any other medical problems, you really need to see a medical person. Hope that was answering your questions there. So just to kind of summarize again on calculating macronutrients or not calculating, the main difference I see is that if you're trying to just lose weight or fix diabetes, then you don't really have to calculate macronutrients. A lot of people come to this area through programs that insist you have to calculate them, but you really don't. Your body knows what to do. You eat less, you lose weight, fix the diabetes. The idea of calculating the macronutrients, getting the fat percents at 70 is a good thing to do if you're trying to achieve a certain level of ketosis, if you're trying to optimize your physical performance or treat a medical condition. So another question came up about how Professor Noakes, how he's doing. Well, we're following Prof. Noakes in South Africa with great concern and also optimism that he's being looked at in a medical sort of way, not as a practice board. And I hope the science was reviewed. I'm confident if the panel looked at all of the science that's available, that they're going to say what Prof. Noakes knows and says and recommends is just fine. So we're all anxiously awaiting and hope to be celebrating in a month or so after all of that brouhaha about what he's gone through. A question about how you go from low carb to ketogenic, and it's really just watching the grams of carbs, using healthy foods, follow one of the programs, either Adapt Your Life or ketogenic programs that are currently available. Hello, everybody, and great to see you, and thanks for the shout-outs. I think that's about it for today. Yeah, please share the video, get this out to as many people as possible. One final note, we're really excited to bring out a new bar for Adapt Your Life. I think it's going to be in the next month or so. A bar that's a little bigger, has a little more protein, a little more carbs, but still you can trust it as being a truly very low carb product. I guess one final note is to watch out for these other products that say their net carbs are low and yet their total carbs are high. Adapt Your Life has distinguished itself as a company that follows the total carb methodology, which is again really important for those who metabolically want to stay low on the total carbs. The new bar is heat resistant, won't melt. Of course, for those who want the first round of bars, they'll still be available, so stock up before the melting season happens, and the new ones won't, so you can take them on hikes, for example. Great to chat with you and hope to see you soon. And that's it for today on macronutrients. I'm Dr. Westman. I'm here in Durham, North Carolina. Hello, and have a wonderful day. Bye-bye.